Hello, welcome to today's session. All right. Last time we looked at the gross anatomy as well as the microscopic anatomy of bones. We looked at the gross anatomy as well as the microscopic anatomy of bones. Today we're going to look at the skeleton. We're starting to look at the skeleton. So before we delve into the skeleton, let us look at the cavities that this skeleton makes up. The cavities that this skeleton makes up. These are known as cavities of the body. We have about 5 cavities. Okay, 5 big cavities. There are smaller ones, but we have about 5 major cavities in the human body. Okay, so the organs that make up the systems of the body are contained in 4 major cavities. And these major cavities include the cranial cavity. The cranial cavity put together with the vertebral cavity is known as the dorsal cavity. All right, the cranial cavity put together with the vertebral cavity is known as the dorsal cavity. We have, secondly, the thoracic cavity. Okay, we have the abdominal cavity and we have the pelvic cavity. Those are the 4 major cavities of the human body. The first one, the cranial cavity, contains the brain, and its boundaries are formed by the bones of the skull. The boundaries of the cranial cavity are formed by the bones of the skull, which we are going to look at just now. First of all, in front, we have the frontal bone, okay? Laterally, we have 2 temporal bones. Posteriorly, we have 1 occipital bone. Superiorly, we have 2 parietal bones, okay? And inferiorly, we have 1 sphenoid bone and 1 ethmoid bone. You'll be able to understand all these bones and where they are located, okay? And then we have the second major cavity. By the way, the cranial cavity also has smaller cavities, which include the oral cavity, where you're going to find teeth, the tongue, you're going to find salivary glands, okay? That is the oral cavity. You will find other smaller cavities, the nasal cavity, where the air passes when you're breathing in and out. You will find the cavities of the ears, all right? So those are the smaller cavities on the cranium, okay? So the second major cavity is the thoracic cavity. This one is situated in the upper part of the trunk, okay? In the upper part of the trunk. All right. So the thoracic cavity is situated in the upper part of the trunk. It is bounded anterolaterally by the ribs, okay? Anteriorly by the sternum in the middle there, in the midline. Posteriorly by the vertebral column, all right? On the upper part, it is open and is continuous with the neck above, okay? At the bottom, it is continuous with the abdominal cavity below. That is our thoracic cavity, all right? And then we have some contents of the thoracic cavity includes the trachea, that is the windpipe, the bronchi, 2 lungs, the heart, the aorta, superior and inferior vena cava, numerous other blood vessels, as well as the esophagus. You're going to find all these structures in the thoracic cavity. Okay, and then we have one other major cavity, which is the abdominal cavity. It is the largest cavity in the body, situated in the main part of the trunk. Okay, so the boundaries are that superiorly there is the diaphragm. This one separates the abdominal cavity from the thoracic cavity. Anterolaterally, we have abdominal muscles, muscles of the abdominal wall. Posteriorly, we have the lumbar vertebrae and some muscles also. Laterally, we have ribs on the upper part, okay? Inferiorly, it is continuous with the pelvic cavity, okay? Now, this abdominal cavity is divided into 9 regions. This abdominal cavity is divided into 9 regions. The regions that it is divided into are 9, and we have covered some of that content already. Okay, so the abdominal cavity is divided into those 9 regions. That is the epigastric region, the left and right hypochondriac regions, the left and right lumbar regions, the left and right iliac regions, the umbilical the umbilical region, and the high the hypogastric region. Okay, so the 9 regions of the abdomen include the epigastric region. Okay, include the epigastric region, the left and right hypochondriac region, the left and right lumbar regions, the left and right iliac regions, also known as inguinal regions, and in the middle there we have the umbilical region, and then we have the hypogastric region. Those are the 9 regions of the abdomen. Each of those regions contains the organs, and it is very important for everyone to know which organs are found in which region. Okay, so most of the space in the abdominal cavity is occupied by organs and glands of digestion and absorption. Okay, these organs include the stomach, small intestines, most parts of the large intestines, the liver, the gallbladder, bile duct, the pancreas. All those organs I've mentioned are contained in the abdominal cavity. The other major cavity is the pelvic cavity, which is roughly funnel-shaped, extends from the lower end of the abdominal cavity. Okay, the boundary superiorly, it is continuous with the abdominal cavity. Anteriorly, we have pubic bones. Posteriorly, we have the sacrum and the coccyx. And laterally, we have innominate bones. You will see them soon and as we start looking at them. Inferiorly, we have the muscles of the pelvic floor. We have inferiorly the muscles of the pelvic floor. The pelvic cavity contains structures such as the sigmoid colon, that is continuation of the large intestines. We have the rectum and the anus. We have a few loops of small intestines, the urinary bladder, lower parts of the ureters, and the urethra. Now, in the female, the organs of the reproductive system are also included there, and these include the uterus, the uterine tubes, the ovaries, as well as the vagina. In the male, some of the organs of reproductive system, such as the prostate gland, seminal vesicles, spermatic cords, different ducts of vast difference, ejaculatory ducts, and urethra. Okay, all these are found in the pelvic cavity. All right, so now let us continue looking at the skeleton itself now. The functions of the skeleton include one for protection. Like we have talked about, we have said that the body is made up of these body cavities, and these body cavities protect delicate organs such as the brain, such as the spinal cord, even the delicate organs of the abdomen. So you find that, especially, sorry, not the abdomen, the thorax, delicate organs such as the heart and the lungs. So the skeleton is the one that is responsible for protecting those organs. The second function is support. So the skeletal system supports body organs and body tissues, muscle attachment. Okay, muscles attached to these bones and provide support. Okay, and then movement. It's because of bones that we are able to move from one place to another. The other function is storage of minerals such as calcium, which is released every time it is needed. If it is if it is low in the blood, there's release of this calcium from the bones. Okay. So that is a picture of the skeleton. This is the picture of the skeleton, and this skeleton is telling us that the skeleton has two major divisions. The first major division is shown by the part that is in blue, and this is known as the axioskeleton. Axioskeleton. The axioskeleton is that skeleton which protects the organs that are essential for life. So, for example, the brain, okay, the heart, the lungs, okay, this part, the spinal cord, this part of the skeleton, the one in blue here, that is the one that is known as the axioskeleton. We have the second portion of the skeleton, and that is the skeleton that makes up the limbs, starting from the shoulder girdle, okay, and the upper limb, the arm, the forearm, the fingers. Then we have the pelvic girdle, the thigh, the leg. And so this part that is in brown, that is known as the appendicular skeleton. So we have two divisions of the skeleton, and we have the axioskeleton and the appendicular skeleton. We have the axoskeleton and the appendicular skeleton. The human body has a total of 206 bones. And those bones that we're talking about are just named bones. Others may not have specific names, and they may be too small, so they're not named. Okay? So we have 206 bones. Okay? Bones of the adult skeleton are grouped into two principal divisions. The exoskeleton has 80 bones, starting from the skull to the vertebral column to the rib cage. We have 80 bones. Then we have the appendicular skeleton, which has 126 bones. 126 bones. Now, when you look at these bones that make up the skeleton, they all have particular characteristics that will make them be grouped in a particular type, depending on how they look. And these types include one, the long bone. You have bones that look like this bone here. This bone has, it looks elongated, then it has two dilated ends, okay? So when a bone looks like this, it has a shaft and two ends that appear larger than the shaft, then this is a long bone. So you're going to find long bones in places such as the humerus, okay? In the arm, okay, such as the ulna and the radius, even the bones of the fingers, the phalanges, all those all those are long bones. Okay, so the long bones are made in such a way that they have a shaft, and this shaft is known as the diaphysis. and they have two ends, okay, two ends that are a little bit dilated, and so they are bigger than the shaft. These two ends are known as the epiphyses. One is epiphysis and two are epiphyses. Those are the long bones. And then we have short bones. Short bones are bones that may not necessarily have a particular shape, but they look short. They don't have, they may look cuboid like this one. They don't have to say, no, this side is supposed to be bigger. They don't even have a shaft. An example of these short bones would be the carpal bones at the wrist joints. Those 8 carpal bones at the wrist joint, those are the ones that are the short bones. We have flat bones. Flat bones are bones that appear flat even when you look at it. For example, the sternum, the bone that is found in the midline and on the anterior aspect of the thoracic cavity. So that is where you're going to find the sternum. Other flat bones include bones like the scapula, the bone at the back, okay? That wing that you normally see when you try to bend your arm to the back, okay? And then we have other flat bones such as the bones of the skull. So all those are examples of flat bones. The third type are irregular bones. Irregular bones are those bones that do not have a particular shape. They kind of even look distorted. So we have an example of an irregular bone being a vertebral bone. A vertebral bone is an example of an irregular bone. This irregular bone it's called irregular because it does not have a specific shape, and this bone changes the shape depending on the position at which it is. That is to say, cervical vertebrae are differently shaped from the thoracic vertebrae, which are also differently shaped from the lumbar vertebrae, and that is those are the irregular bones. And then we have uh, another type of bones. These are known as sesame bones, sesamoid bones. Sesamoid bones are shaped like a sesame seed, okay, like a sesame seed, and that's why they are called sesamoid bones. An example of a sesamoid bone is the patella at the knee joint, is the patella at the knee joint. So those are the types of bones. Those are the types of new those are the types of bones. We have another type of bone. These are known as sutural bones. These bones are found in the sutures of the head. They are small bones that are found in the sutures, just along the lining of the suture. You find a small bone there, and those are the sutural bones. And then we have now bone surface markings. Every bone has structures on it that allow for attachment of things like muscles. They have things on the bone that allow for soft tissue to pass through, for example, blood vessels, for example, nerves, for example, even organs. Okay, some organs will, because the bone has been there, so the organ has been there, and so the bone is going to even have a depression where this soft tissue is going to lie. That is what we are saying, where this soft tissue is going to lie. Now, these surface markings are divided into depressions and projections. So depressions, just like it is sounding, as you are looking at bones, you find that at certain levels, the bones have a depression. And at other levels, you find that the bones may have projections and outgrowth, all right? And processes may also be there, okay? So Examples of depressions and openings. Openings are those places where the bone opens up for the passage of soft tissues. Okay, so depressions and openings allow for passage of soft tissues. Okay, these soft tissues include nerves, blood vessels, ligaments, tendons, or muscle attachments. So one of the examples of an opening is a fissure. A fissure is an opening in a bone. So it will look like a slit in the bone. So if you look at this diagram, there is a very good example of a fissure there. That is an opening in the orbital cavity. Okay, this is where blood vessels will pass from the cranial cavity into the orbital cavity. Blood vessels, nerves, all right, lymphatic vessels, they will pass through these openings. These openings that look like slits are known as fissures. So here in this orbit, we have the superior orbital suture and the inferior orbital fissure. That is what those fissures are. And then we have a foramen. Foramina are openings in the bone. Some foramina may be small, others may be large. So for example, we have these small holes here. We have this hole. It is named according to the position. It is just on top of the orbit. So it is known as the supraorbital foramen. We have bigger foramina, such as that one where the spinal cord is supposed to pass as it is leaving the brain, as it is leaving the cranial cavity, such as this one, which is known as the foramen magnum. This is also a foramen, and it is a very big foramen. Okay, it is a very big foramen. So foramina may range in sizes also. A fossa is a shallow depression on the bones. For example, the coronoid fossa of the humerus. For example, the coronoid fossa of the humerus. If you look at the humerus has in front at the back, there is a small hole at the back where when the arm is extended, the uh, ulna is supposed to go and attach there. So for example, this is the posterior aspect of this arm. So there is a space where this part of the ulna, the olecranon portion of the ulna, goes and enters that fossa the moment the person decides to extend his or her hand. So that is what a fossa is. And then we have a sulcus. A sulcus. We have, that is a furrow along bone surfaces. For example, the intertubercular sulcus of the humerus. The humerus has small projections towards the head of the humerus, and those projections are known as the tubercles. Those projections are known as the tubercles. So you will find that between those two tubercles, you are going to find a furrow. So when you look at this picture, we have this lesser tubercle and we have this greater tubercle, and in the middle there, we have a furrow, okay? That furrow is known as a sulcus. It's not, we're not going to say this is the only bone that has a sulcus. There are a lot of bones that have sulci, but this is one example, okay? And so this one, because it is found between two tubercles, we have the lesser tubercle, we have the greater tubercle and the lesser tubercle. So we are going to call it the intertubercular sulcus. Okay, the intertubercular sulcus is also known as the bicipital groove. The reason is because it is the place where the long head of the biceps lie, okay? The long head uh, of the biceps lie in this sulcus, and that is why it is known as a bicipital groove, because the biceps muscles, the tendon of the long head of the biceps muscles lie in that sulcus, and that is why we call it a bicipital sulcus. The other word is a meatus. A meatus is a passageway which is like an opening, which is like a tube-like opening, a passageway. For example, the passageway into the ear, okay? That passageway here, for example, this passageway into the ear is known as the external auditory meatus. The external auditory meatus, that is a passageway. So a passageway can be is known as a meatus. All right. And then we have condyles. Condyles are large round projections with smooth articular surfaces at the end of the bones. So when you look at a bone such as the femur is that bone of the lower limb. When you look at the bone such as a femur, when you look at the distal part of the femur, the distal portion of the femur, there are these projections on the side. All right, those projections are known as condyles. All right, we have condyles. Okay, and then we have just immediately on top of the condyles, we have what are known as epicondyles. All right, we have what are known as epicondyles. So at the bottom, you have the condyles. All right, so when you look at it from the back, it's even better to see the condyles. This one is a condyle and this one is a condyle. When you look at this human being is facing away. Well, this one is the posterior aspect and this one is the anterior aspect. When you look at the posterior aspect, it means this leg is a right leg because the head of the femur is pointing this side, and so this person is facing away from me right now, and so this person is facing away, which is going to tell us that this is the lateral aspect and this is the medial aspect. Because this is the lateral aspect on the outer side and this is on the inner side, therefore this condyle here will be called the lateral condyle of the femur, and this one is going to be called the medial condyle of the femur. Same applies to the epicondyles. Immediately above the condyles, we are going to find the epicondyles. On the lateral aspect, we are going to call it the lateral epicondyle, and the medial aspect, we are going to call it the medial epicondyle. So those are the condyles and the epicondyles. Those are the condyles and the epicondyles. Then we have a fasciate. A fasciate. A fasciate is a flat, slightly concave or convex area which is important for articulation, okay? Which is important for articulation. A good example of a fasciate is when you look at a vertebral bone, at the top, the part that allows for it to articulate with the intervertebral disc, that is the fasciate. So you're looking at this vertebral bone, okay? We are looking at this vertebral bone, okay, from the superior view, okay? We are looking at this vertebral bone on the superior view. So when we look at it from the superior view, then we have to know that at the top here, where there's supposed to sit a an intervertebral disc, that portion which is flat nicely, sometimes it can be concave or convex, that is what we are calling a facet. That is what we are calling a facet. Okay? And then now we have a head. A head is a rounded articular portion of a bone supported on a neck, supported on a neck. So for example, if we are talking about the femur, we are going to find that the femur has one side which is nicely rounded, okay, nicely rounded, on top of which we have just under it where we have the neck. So this thing here covered in articular cartilage, this is the head of the femur. The head of the femur joins with this hip bone at this joint known as the hip joint, okay? And together, these make up the pelvic girdle. So this one is showing us the head of the femur has nicely articulated with the coxal bone, the innominate bone, okay? So this has nicely made, that has nicely made the pelvic girdle. That is what we are talking about. That is what a head is. And then we have a crest. A crest. A crest is a prominent ridge or an elongated projection. A prominent ridge or an elongated projection. For example, when you look at this same diagram here, you will notice that at the top here, there is that nice projection, which is nice and smooth over there. That is a crest. This bone here is known as an iliac bone. So this is the iliac crest. Okay, this portion at the top, that portion is the iliac crest. That is what we are saying, the iliac crest. The other word we have already looked at are the epicondyles. We have already talked about them. We have epicondyles, e.g. on the femur, and there is the lateral and the medial epicondyle. The other one that we are to look at will be a line. A line is a narrow ridge, mostly on the long bone, okay? A narrow ridge, mostly on the long bone. An example of a line will be the linea aspera on the femur. The femur, when you look at it from the posterior aspect, it is going to have a line, okay? It is going to have a line, okay? And that line is going to be known as the linea aspera. The linea aspera. Right in the middle there, you are going to see that line over there. And that is what you're going to call the linea aspera. Okay, so that is what we're talking about. A line on a bone is going to be known as the linea aspera, and our example is the femur. Our example is the femur. On the posterior aspect of the femur, you are going to find the linea aspera. And then we have another projection, that is the trochanter. This is a very large projection, e.g., the greater trochanter of the femur. So if you come back to this same picture, you will notice that the femur has two projections on both sides. For example, we have this projection here and this projection here. So we have a greater trochanter and a lesser trochanter. Okay, the line that passes between these two trochanters is known as an intertrochanteric line. That one is known as an intertrochanteric line. So that is what we're talking about. We have the trochanter and then we have the intertrochanteric lines. And then we have a tubercle. Okay, we have a tubercle. We have these are variably sized rounded projections, e.g. the greater tubercle of the humerus, which I've already shown you. We talked about the greater tubercle and the lesser tubercle, and we said that between those two tubercles, we have a place which is the sulcus, which is also known as the bicipital groove, where the head of the long head of the biceps rests. Okay, that is what we are saying a tubercle, the line is. And so on either side, we have a tubercle. We have a lesser tubercle and a greater tubercle. That is what a tubercle is, and that is what we're talking about. And then we have variably sized projections that have a rough, bumpy surface. For example, and this is called the tuberosity. For example, the ischiotuberosity. So this ischiotuberosity, like you have heard, it's supposed to have a roughened surface. So when you look at this bone, this is the hip bone. The hip bone is made up of 3 bones in total. It is made up of the ischium. All right, this one in blue is the ischium. It is made up of the pubis or the pubic bone, the one in red, and it is made up of this one in brown, which is the iliac bone. On the ischium, you are going to find this roughened area. This roughened area is an example of a tuberosity, and because it is found on the ischio bone, on the ischium, it is now going to be called the ischiotuberosity. That is what a tuberosity is, a roughened area. The ischiotuberosity is that part of the bone that is used to sit on. You use the ischiotuberosity to sit on. That is what is used to sit on. Okay. Okay. So that is the part that is used to sit on, the ischiotuberosity. And that is an example of a tuberosity. So those are our projections